Hi, I'm Trish Evans here at the Rockville Senior Center, and today we have a lot of important information about COVID-19, so let's get into it. So welcome to this week's Spotlight. We have a very exciting guest, Dr. Mark Landau, Director of Emergency Management for the City of Rockville, and I'm so glad that you are here with us. Thank you.
Thank you, Trish. I'm happy to be here with you.
Great, great. Can you describe your role in general terms with the city?
In general terms, my job in the city is to integrate the city services and functions with the county services and functions in the preparedness and then response to disasters. For example, as we are in COVID now, the city does not have a health department or a health function, and that function lies at the county in the Department of Health and Human Services at the county. So our function is to integrate our resources to help the county health department meet their mission in responding to COVID. So the prime example of that is the COVID testing that's been going on in the city. It's the Department of Health and Human Services that's delivering the testing, but we're supporting them by providing city resources and city facilities to do the testing. So that's how that coordination piece comes together of where the city meets the county.
And how much contact do you have with the county officials and even the state officials, I guess?
It's daily. The coordination, not only for us up to the county, but then also being so close here in the National Capital Region, we also coordinate across county jurisdictions with the district, with the states in Maryland and Virginia, because we have so many things coming together in a small space here in this area. So all of that coordination of assets is very important.
So your role is to help bridge all of those things for us.
And the pandemic has really showed those jurisdictional and authority lines, which have made it very confusing and sometimes frustrating, particularly as we're in the difficult part now of providing vaccinations.
Should somebody be afraid to get vaccinated?
I think it's a discussion that people need to have with their healthcare providers about whether or not they should have it. That's not something, obviously broadly we want people to take the vaccine, but of course that is a personal decision and also can be based upon their medical conditions, whether it's a good idea for them or not. So at the pre-vaccination point, it's a good idea to have that conversation with your healthcare provider about whether or not you should take that vaccine.
But have you been vaccinated, and how was it?
I have been vaccinated. It was not too bad. It was similar to the flu shot. I had a similar reaction to it as I would to that pain at the site, a little bit of fatigue.
You know, you have these outlets of information, but there are a lot of people that don't have access to that technology. What can those folks do? Part of the reason why we're talking about this today is because if they have Channel 11, then they have at least a vehicle to get information. So what can other people do that don't have technology?
For people that don't have that to reach out to, the county has set up a one-stop phone number to get people registered that can't do all of those things. And also one of the big concerns about equity too is it's not as soon as you sign up that it's going to be the order that they came in. They're going to look and prioritize those around the hardest hit areas of Montgomery County, the zip codes that are having very high morbidity and mortality with COVID-19, and make sure that they allocate those vaccines to those areas.
What is a good source for people to listen to? The national news or CNN, or because local news? What's
the best thing to do is to, if able with the technology, is get to Montgomery County's website related to vaccines, and you can sign up for the alerts there, and they will alert you. Also there you can pre-register in all the way through the different tiers. Of course, they've grouped based upon risk to make vaccine available to people. Obviously the challenge is getting with 5,500 doses of vaccine and 73,000 people that are eligible for it, it's going to take a little while to work through those things unless something changes with either the amount of vaccine that's allocated to the state or how the state allocates it within the state.
Thank you so much. I think this is very valuable for all of us, for people at all ages, but especially people who are at home, isolated, seniors, and really appreciate your time.
Thank you.
For more information about COVID-19, please contact the county at 240-777-2982. For other senior services information, always you can call 240-314-8800 and the team at the Rockville Senior Center will be there for you. I'm Trish Evans. Until next time, Rockville.